So my name is Delaynee Lopez, and I am here to get a gastric sleeve procedure done because I always kind of been on the heavier side. When you have a lot of weight on you, it's kind of hard and you get discouraged. I've realized that I can't do it by myself anymore. I've tried everything and it's I fluctuate, go up and down, and I was I need help at this point. So that's when I actually decided to go through with it. Can't wait to share my journey with others and just show them I did it, you can do it. So.
Many of my patients make different reasons as to why they embark on this journey. Sometimes the patient's primary care doctor will ask them to sort of have a consultation with the weight loss program because they're having difficulty with their medical problems. Many times patients just have friends and family members that have had the weight loss surgery and have done so great, and now they're ready to make that decision. The most important thing is that patients have to come to that decision on their own. It shouldn't be because of their primary care doctor or from their loved ones. They have to make that decision and be responsible to take that journey. It takes a lot to get to surgery. I think some patients feel like it's a way of cheating, and sometimes they'll feel like why couldn't they have just done well with diet and exercise? But it's really important to understand that obesity is a medical problem, and diet and exercise is definitely not enough to solve that problem. And the medical community sees this and realizes that, and that's why lots of patients are now coming to have weight loss surgery.
One of my friends did it here, and she recommended Dr. Shaw because the procedure went very smooth. When I got the recommendation to come here, that's what I went with.
Here at Tufts Medical Center and the Weight and Wellness Center, we've had a really unique opportunity to embrace 2020. We've embarked on an exciting opportunity to give our program completely via telemedicine, what we call the Tele bariatric program. This is very fascinating for patients and actually very helpful because there's so many visits that need to be done with the dietitian, the behaviorist, the medical doctors, and myself, requiring multiple visits into Boston, into downtown Boston, and with the traffic and the parking, patients are really appreciating the fact that they can just dial in the comfort of their own homes and get to connect with one of our team members.
It's not easy driving after work during rush hour to meet my appointments. So having that option of doing video chat for your appointments was amazing and very convenient. The appointments that I had were with the dietitian, social worker, Laura, she's awesome, and then one appointment with Dr. Shaw, and that was really it. Everyone at Tufts Medical is so supportive. They're sweet, they're easy to chat with, and they make the journey painless. I'm ready. That's the best word to describe it. Just ready, and I'm just gonna stay positive, and I'm excited.
So patients ask me all the time, what's the most common procedure, or what procedure should I have? The laparoscopic sleeve gastrectomy has become the most common procedure that's being done worldwide, and there are many reasons for it. One, it's probably a little bit less complicated than the gastric bypass, and two, the quality of life is definitely much better. It really depends on the patient.
Hi, Delaynee. It's great to see you.
Hi.
How's your last 2 weeks been? How you doing?
I'm good.
Well, you lost 20 pounds pretty quickly, but you should continue to lose. We want to make sure you're doing like 1 pound to 2 pounds every week. Walking is awesome now, so be walking as much as possible. So push for those new goals. That should help you see a little more weight loss too.
Okay, thank you. You're kind of training an old brain to a new stomach, so there's a lot of mental preparing for that. Honestly, I'm someone who's very optimistic and positive, so I will tell someone that's in this process to do the same and don't be scared.